Rely on multiple medications every day, oftentimes to treat a single ailment. And that brings up an important topic today, polypharmacy. So here to tell us more about it this morning is Nurse Christina from the VA. So good morning to you.
Hi, good morning.
Thanks so much for joining us as always. And first of all, can you describe what polypharmacy is for us and how prevalent is this?
So polypharmacy basically is anytime someone uses 5 or more medications. And sometimes for, like you said, one particular use. A CDC study showed that 69% of people ages 40 to 79 use at least one prescription medication. And so it can compound issues when you use a lot. Polypharmacy, it can increase the potential for drug-to-drug interactions, and it can cause this prescribing cascade. So, for example, you're given a medication, it has a side effect, you go in, you complain about that side effect, and then the doctor gives you another medication to combat that side effect. So before you know it, you're on this just a ton of medications, and sometimes they're not even really necessary.
Yeah, it's definitely something that, I think we've all heard about before. And we're wondering, are there any factors or conditions that might put someone at a higher risk?
Absolutely. So, of course, our older people, and no offense, but if the definition is over 62, which I don't think is old, but older people, but they do have a different absorption rate, distribution, their metabolism slows down as we get older, excretion changes, your fat to muscle proportion changes, and your kidney function can decrease. All of these things can contribute to having different side effects, or taking too many medications can cause more trouble. You might have different cognitive abilities that can be a problem with these medications. Lack of primary care follow-up, like that is huge. Healthcare providers really need to make sure we're staying on top of it. You might see a cardiologist through Aspirus and a GI specialist through Marshfield Clinic, and then come to the VA for your primary care. Well, if everyone isn't communicating, and if patients just go in and say, whatever you have on the list, that's my medication list, that can cause a real problem.
Wow, yeah, it's totally understandable. And so it sounds like this can happen to a lot of people, but if we're concerned about polypharmacy with a loved one, are there certain behaviors or other things we can be looking out for?
Absolutely. So you want to watch for, maybe if you have a loved one who's had a lot of falls recently, you're noticing some cognitive impairment. So they're having trouble thinking, memory loss, dementia, even trouble with words, difficulty performing day-to-day tasks. Maybe they're all of a sudden becoming they're having urinary incontinence, meaning they're not able to make it to the bathroom in time. They're just poor nutrition. They're not eating. They're not hungry. All of these things can be warning signs.
Great. And lastly, could you share some tips just for safe medication management?
Of course. So one big thing is using the same pharmacy. That is huge. If you can stick with the same pharmacy, then we can get, a total list of your medications. Review all your medications with your nursing staff every single time you go in. Bring your medications with you, or a current list, to include any over-the-counter medications. That's Tylenol, any vitamins, supplements that you take. Let your provider know if you can't afford a medication. Oftentimes, there's different medications in those classes. Similar to Coke and Pepsi, they're both colas, just different products. Well, sometimes there's medications for blood pressure or anticoagulation that are, blood thinners that are the same, just a little different. And so your provider can help with that. And again, make sure when you're traveling, you take your medications with you. And I just can't stress enough to bring in your bottles and review those medications at least once a year with your provider.
Very, very important, and some really great tips there. Thank you so much for joining us. It's a very important issue.